Hello, Mr. Smith. This is Dr Balian here.
Like many services, GP practices have been seriously impacted by COVID-19. Phone calls, video consultations and online support have become much more commonplace as the NHS has sought to control the virus.
COVID is a nasty virus. It kills people. When the pandemic first hit, we were instructed by the Department of Health to ensure that both our staff and our patients and the general public were safe. And so we had to change the way that we provided care for patients. And actually we developed very rapidly new ways of consulting with patients, most of it remote, which hadn't really been done before.
There is clear evidence that people's physical and mental health has deteriorated during lockdown. It's also known that a lot of people have put off going to see their GP, either because they don't want to put extra pressure on vital services or they've been worried about accessing healthcare during the pandemic. And that's meant that now GP practices are experiencing high numbers of patients trying to contact them. In January to March last year, approximately 779,000 appointments took place, an average of 260,000 a month. But in the same period this year, there were around 837,000 appointments. That's 279,000 a month, an increase of 7.5%.
I would really just urge everybody to be perhaps as patient as they possibly can whilst we allow the GPs to continue to do their work. And there are, of course, other options available to them.
Pharmacists are there to provide healthcare advice on minor illnesses like coughs, colds, stomach complaints or hay fever. And minor injury units across the county can provide treatments. Accident and emergency departments in hospitals really are there for life-threatening emergencies. The 111 service is there 24/7 to provide advice, treatment and care. Just call that number or go online. And if you or someone you know is struggling with their mental well-being, Mindline is open to people of all ages. GP practices have taken on a lead role in the rollout of the vaccination programme. 70% of all jabs have been done at GP-led community sites. And that's on top of the day job.
The number of consultations that we've had in my practice every week has gone up from 650 contacts a week in 2019 before the pandemic to 900 contacts a week now. That's a 30% increase in activity. We've tried to manage that by getting a lot of extra locum doctors and nurses in to help, but it's never enough. And we only have a finite number of resources. And so inevitably, we've had to prioritise patients, and we're still dealing with the ones that need to be seen or dealt with urgently.
GP practices are still having to follow national guidelines to prevent the spread of COVID. Social distancing means there's less space in waiting areas, and appointments are taking longer because of the need to clean down in between every patient. So the message from GPs is, please be patient with us. I'll see you next week.